Hi, my name is Kimberly Watts, and I want to discuss with you a public health disparity, and it's about infant mortality in Jefferson County, Alabama. What we will do is go into the who, what, when, where, and why, and how this has happened. Well, I just stated that who is affected? Really, everyone is affected because it stunts the growth of our community. Usually, it's families of color or families in low income neighborhoods, those with limited access to resources, day to day resources, and healthcare. And um, what is going on is there are 12.4 per 1,000 births of children of color compared to 4.3 per 1,000 Caucasian children that are mortalities. The infants of color have 3 times more chances of dying before their first birthday than Caucasian children. The interventions are gathering data and having interviews and exposing women to the opportunity to be healthier themselves and healthier for their babies. We are currently witnessing the health department making strides towards reaching out and making it easier for the residents of the county to get to the doctors at the health department or the doctors that accept Medicaid so they can get prenatal care and postpartum care. Where we're talking about in the Birmingham metro area and the surrounding hospitals of the area. Some of them are considered satellites. And why we're doing this is because infant death needs to be prevented to give children a chance at life. Addressing disparity saves the life of the community and it lowers the cost of health care. Early infant death is indicative of the present and future of the community negatively. Is the result of a lack of access and producing poor outcomes when there can be an effort to do better with this. And we wonder, how is this a disparity? And the reason why it's a disparity is because we have high poverty rates and poor education in a lot of our uh, women that are pregnant. And some of the practitioners, the healthcare professionals, they're not aware of the numbers of women that cannot make it to them for care. Sometimes it's the lack of access to the location where the specialists are in the city, and it's more prevalent in what we call the Black Belt region of Alabama. And then we have environmental factors such as pollution in the air that slows down the number of healthy babies because there are other health conditions that are created. Then we have a lack of trust in healthcare uh, systems due to shrewd. I'm sorry. Um, due to skewed opinions, either online or verbally, through bad experiences, and we want to prevent that. And some of the steps to advance a positive initiative for this disparity is to expand Medicaid to cover women throughout their pregnancies and after, so we can make sure that both the baby and the mother are healthy. And then we have a need to build maternity care availability by placing satellite clinics in the Black Belt regions, or the clinics can be mobile clinics or satellite clinics. And then we can expand assistance and food provisions, stable housing, safe living conditions, and reliable transportation, workforce training and diversity for healthcare professionals will with CEU incentives. And we can strengthen community engagement by allowing the residents that are affected by this disparity to participate in creating interventions for policy, creating interventions and policy creations and health education needed for the community. I am anticipating a decrease in rates of infant mortality in the upcoming years because technology is expanding and telehealth is going to probably play a huge role in reaching out to care for those in need before we can get uh, the clinics built. And I know personally of a physician that has a mobile clinic, and I am hoping that some of the other local physicians will get on board. Thank you for your time.